Hello, my name is Courtney Martell, and I'll be doing my project on the biopsychosocial review of cancer. So what exactly is cancer? Cancer is something that can occur in any part of your body. Normal cells divide in an orderly manner, and cells die when they are damaged or worn out, and new cells can take their place. Cancer cells, however, start to grow rapidly and out of control. They continue to grow and overcrowd the normal cells. And this starts to cause problems in the part of the body where the cancer is present. Cancer can start in places like the lungs, colon, breast, and even the bloodstream. Cancer can also spread to other parts of the body. When cancer cells spread, it is what's called metastasis. Some cancers grow and spread at a rapid rate, while others grow at a slower rate. Not all cancers respond to the same treatment. Some require aggressive treatment, some can be treated best with surgery, while others need drugs like chemotherapy. Most cancers form lumps called tumors. However, not all tumors are considered to be cancerous. Tumors that are not considered cancerous are called benign, while tumors that are cancerous are called malignant tumors. Cancers like leukemia, however, do not form tumors. Leukemia is cancer that starts in the blood. The cancer of leukemia grows in the blood or other cells of the body. Each year, cancer affects approximately 14,000 children in the United States alone. Intense treatment has led to a 5-year survival rate of just over 80% of all cancer types in all cancer patients. If a child is considered to be in remission from their cancer is considered to be dead or gone. However, there's much more than just a biological and physical outcome that the patient needs to be considering. There's also social, emotional, and psychological problems that need to be addressed and dealt with. Parents of cancer patients also experience a lot of psychological effects like stress, anxiety, depression, and especially self-blame. One major issue that causes a parent's mind is the uncertainty. Their biggest fear is the unknown. If the cancer will be back, if it comes back, will the child not survive the second round? The unknown is the most worrisome for any parents. When a child is diagnosed with cancer, it is one of the hardest times not only for the child, but also the family. It's intense, and it's a very enduring and exhausting experience. There are so many invasive medical treatments. It interferes with the family's everyday life, normal activities, and it goes on for a very long period of time. When a child or anyone is diagnosed with cancer, having a strong social support system is key. It helps deal with any form of anxiety or depression that is most likely to occur. And the stronger your support system, the less anxiety is likely to occur. Having a smaller size support group shows to contribute to more social constraints and less sense of belonging. Siblings of cancer patients also experience psychological problems and emotions themselves. They tend to experience post-traumatic stress and emotional reactions like shock, fear, worry, sadness, anger, and even guilt. They also display difficulties in emotional, family, and social settings. Breast cancer. Breast cancer is one of the leading causes of cancer and death among American women. Unfortunately, 1 in 11 women will be diagnosed with breast cancer in their lifetime. 150,000 new cases of breast cancer are diagnosed in the United States each year. this is the most frequent among women. There are 43,000 deaths from breast cancer each year, second only to that of lung cancer. 1 in 8 women will be diagnosed with breast cancer in their lifetime, and 3.5% of these women will die from the disease. The loss of a woman's breasts threatens the very core of a woman being able to think she is pretty. Victims not only need to deal with the issue of breast loss, disfigurement, but they also need to face cancer and the possibility of death or recurrence. Patients who have a mastectomy have to come to terms with losing a breast, potentially having a fatal disease, and the possibility of cancer coming back. 99% of breast cancer patients said their biggest fear was reoccurrence of their cancer. The second fear was death. Pain, depression, and fatigue are all common side effects of breast cancer. Depression has been linked with the overall elevation of plasma, epinephrine, and norepinephrine. Once a patient is diagnosed with breast cancer, women set out on a psychological journey to find the cause of their cancer. Some females use self-blame, birth control pills, microwave ovens, even husbands and their excessive sexual demands, and the belief that cancer can be inherited or caught from someone else. There's a fear of disfigurement, treatments, the loss of energy, additional expenses, the new demands on time and treatment, social isolation from friends and family, and again, the unknown. There was a study by Irvine and colleagues that discovered that 12% of patients with breast cancer suffered more sexual problems than those with benign breast cancer, and 46% experienced elevated levels of psychological distress. However, after the first year, the psychological distress declined to only 30%. Body image and how they perceive themselves is very important to feeling like a woman and to feel pretty. When a woman's diagnosed with cancer, their thoughts about their body image can change. Both images of your own mental picture of your body, your attitude about your physical self, or your health and sexuality. Women who started out having a better perception of body image before their cancer had a better time coping with having breast cancer. However, some negative perceptions of one's body image could include not feeling feminine, the loss of body integrity, not wanting to look at yourself in the mirror, frustrated with your appearance, and frustration and discouragement of your surgical scars. Sex drive in cancer patients typically declines, especially in women's sexual drive in the first year after breast cancer treatments from vasectomies and chemotherapy. After the first few months of treatment, sexual desires decrease for women who are receiving chemotherapy compared to those who didn't. How a woman perceives her body image is affected more by having a mastectomy compared to breast-conserving treatments like chemotherapy. Prostate cancer. The prostate is a gland that is found only in men, and it produces some of the fluid that is found in a man's semen. The prostate is located below the bladder and in front of the male's rectum. The size of the male's prostate changes with age. Almost all prostate cancers are developed from the gland cell, the area where fluid is created and then added to semen. There are other types of prostate cancers, including sarcomas, small cell carcinomas, neuroendocrine tumors, and transitional cell carcinomas. Although most of these other types of prostate cancers are rare, they still do exist. Some prostate cancers can grow rapidly, but most are known to grow slowly over time. There have been instances where patient and doctor both were unaware that a patient even had prostate cancer because signs and symptoms were not present. Prostate cancer is the most common cancer among American men, behind skin cancer. 1 in 7 men will be diagnosed with prostate cancer in their lifetime. However, most prostate cancer is found in older men. 6 in 10 cases are found in men over 65, and it's rare to be found in men under 40. It's also the second leading cause of cancer-related death in men, only to that of lung cancer. About 1 in every 39 men will die of prostate cancer. However, most men that are diagnosed with prostate cancer, they don't die, and it's not a life-threatening disease for them. In fact, there are over 2.9 million men in the United States who are alive that have been diagnosed with prostate cancer. Chemotherapy was first used in the 1950s, and it's a set of strong drugs that are used to fight cancer cells in different parts of your body. However, there are over 100 different types of chemo drugs that are being used today, and it depends on the type of cancer, the stage, and the aggressiveness of the cancer. Chemo can be used to stop the spreading of cancer, slow down the growth process, kill cells that may have spread to different parts of the body, make side effects from the cancer less severe, and even cure your cancer. Some side effects of cancer and chemo are nausea and vomiting. Nausea and vomiting can start a few hours after treatment and usually last short periods of time. However, there are some cases where it lasts a few days. Hair loss. Some drugs can make you lose your hair on any part of your body, from your head, arms, face, legs, and even your groin. Some chemo drugs make you lose your hair at a rapid rate, while others only make your hair thin. Mouth and skin changes. Chemo can cause mouth sores, make your skin itchy, dry, redness, peeling, or even a terrible acne. Some people, unfortunately, are even allergic to chemo, and it can cause hives, itching, and shortness of breath. Fertility. Some people often have problems with fertility after chemo and are unable to have children. The effects do not always go away, though, once chemo treatments are done. Memory. Unfortunately, chemo can affect your memory and thinking, and it can last long after chemo is done. Bone marrow changes. All of your white and red blood cells, along with platelets, are made from your bone marrow. When you go through chemo, your blood cells counts can drop. This can cause problems in its own. Your red blood cells drop. You can feel weakness, shortness of breath, you feel tired, and it can make your skin, mouth, or gums look pale, because your red blood cells carry oxygen from your lungs to different parts of your body. Your white blood cells. These fight infection. Chemo lowers your white blood cell count, making it harder for you to fight infections, colds, and even can make you sicker. Platelets. Platelets form blood clots to help you stop bleeding when you receive a cut or a wound. If bone marrow is not able to make enough platelets, even small cuts can bleed in excessive amounts. I chose cancer because, unfortunately, my family has been plagued with cancer. 3 of my aunts have dealt with breast cancer, 1 with cancer for the breast that also spread to her brain. My grandmother was diagnosed with colon cancer, and my aunt just recently passed away from stage 4 cancer that started in her colon and worked up to her uterine, her kidneys, her prostate,